جليل، ازيك؟
اهلا عمر.
اهلا
اهلا.
وسهلا. انت دلوقتي في دبي صح؟ حسب ما انا فاهم ما بين دبي ومصر. back and forth.
دبي ومصر وعمان. نعم.
وعمان.
وعمان.
It must be a very exciting time. We're all following the news with Altibbi, and it's such a pleasure to have you here and always leading the way in kind of الطريقة اللي بنبص بيها على digital health and trying to really educate people about it. What kind of goals do you have now? ايه اللي انتم مركزين عليه؟ ويعني Altibbi في 2021 what kind of milestones are you looking for, and what's kind of tell us more about how the vision and mission is coming together.
Thank you, Omar. Yeah, it is indeed a very exciting. The pandemic has taught us so much. It really stress tested everything we do على scale ما حصلش. We're actually working a lot on that. Our mission has always been better health for all, which is easy to say, but basically what we're trying to do is provide two seemingly contradictory things, which are affordability and high quality. We want to put them together, and this is what we always strive for and work very hard towards. Definitely with COVID, we had to scale very fast. We worked with the government of Jordan on the COVID hotline, the 111 hotline. We worked with the government of Egypt on the 105 hotline. We suddenly started scaling from 2,000-3,000 consultations per day to up to 25 and 30,000 consultations per day. And that really taught us a lot. It's completely different when you manage those 2,000-3,000 consultations per day, the quality of that, the doctors, the number of doctors, how we teach the doctors, how you manage that quality and make sure that they're delivering the same quality than when you're talking about the 20 and the 30,000 consultations. It's completely different. So we really had to invest very much in technology, in AI, to help the doctors make better decisions, to evaluate the content and the consultation efficacy and quality much better, and to collect better data from the patients. So all these together really helped us and enabled us to go towards that. But it's not only that, at the end of the day, again, our goals have always been the same. We look at healthcare as a lifetime journey. So we started with content, Altibbi.com being the largest Arabic medical website in Arabic language. Then we added primary care, telehealth, bookings, and clinic management system. And we keep integrating more and more pieces of the healthcare journey and integrating with the other healthcare stakeholders so that the entire journey of the patient when it comes to healthcare is integrated in one place, which is Altibbi.
Mm-hmm. And that's a very bold vision to have, and you're trying to not just focus على one part of the journey, but you're trying to do a lot of it, and you're going higher into your technology stack too. I noticed a bunch of papers that you published on AI, and I'd love to go back to that conversation about what pushed you to publish papers. It's not something that we see a lot of digital health companies in the Middle East doing, but I think it's great inspiration for everyone to kind of catch up with the rest of the world. Tell us about what value you see in publishing, and what pushed you to publish in the first place.
It's it is actually kind of funny because we did not appreciate publishing. Middle East is not renowned for publishing scientific papers in any field. We actually we used to do some AI work and deep learning work, and we had this conversation, and I remember with one of the big global companies, and we were discussing with the technical and product teams and this company, they were explaining our features and pitching this and that, and they were impressed, and wow, you do all of this, and where can we see any information about that? Do you have any published papers? And it's it was a eureka moment. We realized, we have to publish papers. We have to show the world what we can do, and what better way than scientifically peer-reviewed papers, showing what great technology we're building. That's how we started getting into it.
Mm-hmm. And it's a great lesson, I think, for everyone. We tend to think that we need to, hide ideas away. I find this conversation with a lot of entrepreneurs like trying to hide their ideas, because if someone else takes the idea, they're going to be, the successful ones, and it's not about that, right? It's about a lot of teamwork and luck and putting things out there and seeing what comes back in many ways. So I was really excited to see these publications, and congratulations on kind of moving the industry forward. And I hope a lot of other companies follow suit. Another thing that's really interesting with your vision, when you talk about healthcare for all, I noticed a new initiative called Altibbi Mama. Can you tell us a little bit about that?
Yeah, it's a new product that we announced. We've been actually debating and then planning and working on this application for, I think, 3 years now. Because many of our users using our primary care telehealth or navigating our content, etc., are moms. They're females, moms. They worry about their families. They're the health decision makers in the family. And we realized that a lot of their questions are about maternity. And we were debating whether to create something within Altibbi itself or create a separate product completely to cater to this segment, which is actually half the population if you think about it. And that idea won. We did some analysis and we realized moms want something that caters to them. They want news content, separate features that might not be available for everybody else. And we put a lot of effort to create specific content, specific designs, specific colors, everything, so that moms would find it interesting. And indeed, the data we have so far, we released it only 3 weeks ago, and we already have, north of 30,000 downloads in 3 weeks, and 3,000 to 4,000 daily users already. It's overwhelming to see that whatever we were planning, this far exceeded our expectations. Mothers wanted it, and unfortunately, there aren't many products out there catering for moms. We have a couple of websites, some content, but something so integral that caters content together with doctors and follow-ups and family files, etc. All of that is in Alitbbi Mama, and that's what we're proud of.
Yeah, I think it's very interesting that you repackaged a lot of the components that you had and put a lot of effort into understanding a new user, and it seems like it paid off, like that instinct. And another, speaking of like putting specific effort towards healthcare for all, another thing that you guys are known for is a lot of humanitarian work. So I see you reacting a lot to the crises that happened most recently with Palestine, Gaza, and the refugees, and trying to make the product more accessible. And that's part of your vision that is very commendable. Tell us a little bit about like the reaction when you made Altibbi free to Palestinians, and you also did the same with Lebanon and in Sudan. So first tell us about the reaction, but also why do you do all that? Like why do you work towards helping people? I'm sure you have a lot of investors that are telling you, no, go after the money. I'm sure no one says no, don't help these people, but it's not common to see a company do all these efforts consistently. So I'm trying to also get others to see what you see in this humanitarian work.
Yeah. First of all, our investors never said no, so I'll give them that. Give them that credit. Second, the reactions were overwhelming, to say the least. And a lot of the reactions we got, they actually make us they're very emotional. They honestly make us tearful, and we share that internally within the team, and they're all kind of touched. And we share these reactions with the team internally also to keep reminding ourselves what we stand for. We stand for better health for all, but most importantly, we stand for health. Health is humanitarian by nature. I know in this region we kind of we forgot what the connection between health and humanity sometimes, because healthcare is a lot more of a business these days, especially specifically in this region. But it is a right. It is a right for everybody to have quality healthcare delivered, and we never forget this. And this is exactly why our mission and slogan is better health for all. This is what we stand for, and this is what drives us every morning, every day to work in this company, in this field. And it's not an easy field, you know that, Omar. This is a very tricky field. It's full of regulations, a lot of liabilities and hard work. It's not an easy one, but this keeps us working for it. Otherwise, we'd be nothing different than a gaming or an e-commerce company. Nothing bad about that. But we are Altibbi. We are a healthcare company. We're a digital health company. We believe in healthcare. We believe in humanity, and we believe that digitization and technology helps making that even more accessible.
Yeah, I've never heard anyone in healthcare technology say that it's easy or that it's a walk in the park. It's an incredibly challenging and many times very frustrating industry to be in, honestly. And I don't know if we're stuck in it because that's our experience and background, or we like the challenge. But either way, thank you so much for what you do and going above and beyond in every way, really. And that mission of health for all is something that I can really get behind, and hope to collaborate with you and support you as more and more people start realizing that this is the future, and the future starts becoming more of the present. But until then, we have to kind of stand up against barriers and regulations and stigma and a lot of things.
Relax, absolutely. And thank you for the work for spreading the word about digital health and informing people how necessary it is. Relax, kudos to you too. Thank you.
Thanks, Jalil.